Hi, this is Jessica Guglielmo, and this presentation is all about organizing your shift. First, let's touch base about what this presentation includes and what it doesn't include. So, this presentation includes suggestions or tips for using nursing brains, organizing your shift, and time management strategies. What it doesn't include is it's not a comprehensive list of nursing brains or a step-by-step guide to organizing your shift. Everyone is different and organizes their shift differently. Here are some tips for organizing your shift. First, do a quick pre-report chart review. This occurs before handoff report. You're going to look for things like overdue meds or abnormal labs that you might want to be touching base with the previous nurse before they leave. Second, research your patient prior to starting care. So before you go into the room, try to look up as much information you can in the time that you have. Third, ask your patient what you can do for them when you are there. That way you can provide any care that they might need while you're there instead of going back multiple times or having multiple call lights. Fourth, prioritize your tasks. Choose which tasks are highest priority and which ones can be done later or by the next shift. Things like scheduled medications, urgent care tasks, etc. might be higher up on your priority. Fifth, write things down and eliminate extra tips. I'll be going into these two things in the next couple slides. Eliminating extra trips to your rooms goes a long way towards organizing your shift. First, think about supplies prior to heading to your patient room or rooms. Know if you're giving a medication, what needles or tubing you might need to give that medication. Next, note potential tasks or issues when you do your initial assessments. At the beginning of your shift, when you go in and assess your patient, do they have any IV bags that might run out during your shift? Or do they have a dressing that needs to be changed during your shift? This way you know what needs to be done during your shift and can organize it with other tasks. Which leads us to clustering care. Let's say you have meds due in an hour. Maybe do your wound change at the same time instead of going into the room two separate times. Finally, check for new orders prior to heading to your room. Sometimes doctors can place an order that you might not know about. By checking the new orders prior to going in, you won't be going in multiple times. Write it down. I can't emphasize this one enough. As a new nurse, you can get overwhelmed with information. Writing things down helps you remember everything, and it relieves stress over remembering every task in detail. Write down or print out your scheduled medications. Write down a to-do list for your shift. What procedures does your patient have? Or specific care tests, such as wound care, does your patient have? Write down important PRN medications. Write down key lab results, such as white blood cells, hemoglobin, hematocrit, platelets, sodium, potassium, magnesium, and other key abnormals. Write down the diagnosis and any key medical history. Write down their code status so that if anything urgent happens, you know it immediately because it's written down right there in front of you. And write down the previous nurse handoff report assessments. What did they see for orientation, the skin, the musculoskeletal? Can they walk? How can they walk? Do they get oxygen? Do they have any tubes, drains, IVs? Where are they? Are they continent or incontinent? Speaking of writing things down, let's talk a little bit about nursing brains. Nursing brains are a piece of paper that is used to capture and keep key patient information organized. This is where you can write things down. What's included in a nursing brain? Well, common sections are diagnosis, patient history, medications, body system assessments, notes or to-do lists, and labs. Some other sections might include the patient's age, their code status, their room number, diet, bowel movements, pain, IVs and drains, procedures, allergies, their plan of care or discharge plan, and vital signs. Here's an example of a brain sheet. It includes a lot of information in this one. You have a room number, who the patient is, their age, their sex, when they were admitted, what's their diagnosis, what's their significant hospital or medical history, their body systems, room for their labs, their plans. This is a very extensive brain sheet. Here is one that's a little bit more simple and actually includes 2 patients in one sheet. You have your room number, the name, the code status, any allergies or diagnosis, an assessment, and an area you can keep track of their medications that are due. For this brain sheet, you see a little gray box that says Patient ID label. Here you can print out the patient labels that will include things like their name, their medical record number, their birth date, their code status, and put them on there. I wanted to include this one, because it allows you to have multiple patients in one page, and also shows that you can print things out. Some systems, such as Epic, will actually allow you to print out a lot of this information instead of having to make your own brain sheet. Finally, let's go over some basic time management tips that can help you during your shift. First, as we've talked about before, set priorities. Know which care tasks and which patients and which assessments take priority, and do so. Be flexible. Things are going to change during your shift. Nothing's going to go as planned all the time, so try and be flexible. Cluster your care, as we discussed previously. Arrive early. Especially when you're new, this can give you some time to orient yourself to the unit and to the patients. Take breaks. You don't take care of yourself, you can't take great care of your patients. Be proactive. Anticipate the patient's needs. Like we talked before, when you go in for your initial assessment, see what the patient might need throughout your shift. Create routines. Prioritize and execute tasks in a certain sequence that you always follow or try to follow. This can help you with not overlooking anything or forgetting them. Plan time to chart. Most of the time, a lot of nurses chart whenever it's between patient care. But if you can plan some time out during your shift to chart, it'll allow you to have extra time to make sure to get it done. And lastly, don't overcommit. Prioritize your tasks, and if there's tasks you can't get to that are lower priority, go ahead and endorse them to the next shift. That's all for now. I hope that this presentation helps you to better organize your shift in the upcoming clinicals and as a new nurse. If you have any questions, please reach out to me. Here is my email and my phone number. Thank you.